Good afternoon, everyone, and welcome to NASM Live. My name is Prentiss, and I am here, as always, with Wendy Batts and Marty Miller. How are you all doing today?
Fantastic.
Great, thank you.
All right, and today we're going to continue our discussion with CES, and we want to dive a little bit deeper into the first two steps in the corrective exercise process, which is an inhibit and lengthening. And I'm just going to say something about that briefly, and then I'll let the two of you dive in. So ideally, what we want to accomplish in inhibit, to use a simple analogy, we want to turn the volume down in that muscle so that we can actually go to the second process and allow flexibility to occur. So these two steps are very important before you take your clients through any sort of intense exercise, or even try to do the next two steps in the corrective exercise process. So Marty, can you tell us what's happening? What's the nervous system doing? What's happening chemically when we inhibit a muscle?
Gotcha. Well, there's a lot going on. I mean, we've all, throughout the time gotten either massage or just felt something tight, and we just, started to just kind of grab a muscle and squeeze it. It's just almost like a natural thing when we feel some level of excitement in a muscle. So really, in the simplest words, as you said, it's turning it down. So what's happening is that increase in pressure, the body senses that, and the Golgi tendon organ is like, whoa, wait a minute, there's a lot of pressure here. I'm going to relax myself. So I'll go back to why that is thank goodness, Prentiss, I'll speak for us because we're men and we would do stupid things and get hurt, that our body has these natural protective mechanisms. Wendy's smiling because she knows we're right. That if there was too much load, we would just kind of keep trying to lift it, right, Prentiss? And then eventually something bad could happen, like, too much tension could cause a strain, a stress, a snap. So there's this protective mechanism in the body, your Golgi tendon organ, that senses, hey, pressure's building up here. I don't like it. Too much pressure. I'm going to cause a relaxation. So we can use that protective mechanism to our advantage by using foam rolling. So we put some pressure into the body and the muscles sense that, and then just causes actual relaxation of that muscle. So really that's all we're doing is getting the central nervous system to sense the pressure and then say, okay, that's enough. Let's just calm it down and let that muscle come back to its normal resting, excitability, I should say.
Okay. And Dr. David Bain, who's one of the current leading researchers in flexibility, also mentioned a couple of other mechanisms that are in place when we're doing any type of myofascial technique. Can you explain a little bit what's happening at the muscle spindle when we're in inhibition, when we're practicing inhibition in the corrective exercise process?
Mm-hmm. So the muscle spindle, again, is another protective mechanism. It's going to sense length and rate of length change. So, the example I like to use, if we're playing a sport and I stick my arm out and somebody runs past me and all of a sudden their force is taking my arm behind me quickly, I don't have time to process that information. That rapid stretch will be sensed by my central nervous system, and the muscle spindle is going to cause it to stop that rapid stretch by tightening. So again, these Golgi tendon organs and muscle spindles play together in the sense of protecting the body. And one senses the rate of change, and the other one senses a rapid change in length. And they'll both at some point cause the muscle to stop, so that way there's no injury. And then you can use those to your benefit to cause a relaxation.
Okay. All right. So we did, at one point in our previous text, our recommendation was to just hold the area when we're doing inhibition for 30 seconds. But now we've relaxed that a little bit, and we've started to include pinning and pin and stretch, and in some areas continuous rolling. Can you explain why we've taken that path now?
Certainly. So a couple different things is we've always said with NASM, when the research shows that we need to add something to the model, we'll add it. So more and more research has been done on foam rolling, and like we used to call it self-myofascial release. Now we're calling it self-myofascial rolling because sometimes the answer isn't as always clear on what's going on. We know it works, but there's always been advanced techniques from the physical therapy world. Wendy's a licensed massage therapist. There's always these techniques that have been utilized in hands-on therapy. So now there's been more research on, can you do some of these with an implement roller to get extra or maybe more benefits from just that standard rolling. So NASM went out and dug through the research, made sure that it was the best apparent research out there, and has added things like the pin and stretch. So the pin and stretch is now you're just applying pressure and then you're going through a range of motion while you've got that foam roller pinning the muscle down. Now, there could be more pressure into that muscle, activating the GTO, et cetera, but it also helps limit that muscle, kind of pins it down, and then now you can really focus on more isolated parts of the muscle as well, because you kind of lock that portion down, and then as you add the range of motion, now you can really be more specific in targeting how you want to improve that muscle's mobility.
Okay, great. Now, are there any other mechanisms that you can think of that we've talked about in the text that are happening when we inhibit? I know one of the things we talked about was hydration, that pressure causing a fluid exchange. Can you talk about that a little bit for our listeners?
Yeah. So again, as we'll highlight one of the key features when we talk about it a lot, but there's always more going on from a central nervous system, also from the lymphatic system, et cetera, because there's always fluid in these muscles, right? We're hopefully extremely hydrated. We're all going to have hydration to some level, but we are moving fluid at the same time. So as you're moving the foam roller back and forth, you're not just affecting the muscle tissue, you're affecting the nervous system, as we've already talked about, but you're also affecting, the fluid within that muscle as well, to get it like a pumping effect in a sense, and increasing circulation, moving fluid throughout that muscle. So it's great for recovery as well as from a warm-up technique. And that's why we use it before and after.
Okay, thank you for those explanations, and I hope that's clear to everyone who's listening. So now, Wendy, that we've turned the volume down, we want to stretch these joints or move these joints through a greater range of motion, increase some of the extensibility in those muscles. Why do we lengthen? Why do we lengthen? And how do you know what to do? I'm still stretching my hamstrings, and well, not really, just fatigue effect. Now I'm not getting any more flexible. So what's happening?
Well, techniques like static stretching and assisted PNF stretching are used to restore the ideal length-tension relationships that enhance range of motion of specific joints that were identified as limited during the assessment process. So lengthening techniques like the static and assisted PNF stretch don't actually make the muscles longer, but they're leveraging the nervous system to increase the stretch tolerance of the targeted muscles. So increasing the stretch tolerance will improve the tissue extensibility and the ability of the joints to move through greater ranges of motion during exercise. So to kind of put it a little bit differently, lengthening techniques help to further calm overactive and shorten muscles down. And that's going to minimize the effect of altered reciprocal inhibition during activation and integration steps of the corrective exercise continuum. So this is going to lead to improved force couple relationships and enhanced movement patterns. And so that's why we do it immediately after the inhibit, in the continuum. So we would foam roll, or, we would use the inhibiting techniques first and then go into the stretch.
Okay, perfect. So the next question for you, Wendy, is so how do you know? How do you know what we should be lengthening? And can we do just a general head-to-toe yoga routine? Is that going to be beneficial for everybody?
So it comes down to what we've talked about, and everything, what's their basis of determining what even kind of program to design. It's assessments. So do the transitional assessments, look at the overhead squat, see what compensations are happening after you put them in the 5 kinetic chain checkpoints, see where the deviations lie, mark it down, If you're new to this type of stuff, use the solutions table to find out what muscles are overactive and what muscles are underactive. And then the muscles that are showing up as overactive are the ones that you want to use these specific two techniques to focus on first. Because what we're trying to do is gain ideal length back into that muscle that has been shown to be shortened or overactive.
Okay, yeah, thanks for that explanation. So what are some general, when we're lengthening, what are some general guidelines? How do we do it? How do we implement it? How do we do inhibition and then this next step without taking up 30 minutes of our training program?
Well, again, it does take practice. And the more that you do this type of thing, you're going to realize how long this stuff takes. We've talked multiple times in the past about, doing the assessment, writing down all of these muscles and areas that you need to focus on in order to get greater length back into those shortened and overactive muscles. So you can give your clients homework to do at home so they can work on those. But in the gym, if you choose anywhere from I would say 2 to 3 or even 3 to 4 specific areas to focus on that are causing the biggest compensations, that are going to be the most critical in the program. If you focus on those, I think ideally you're going to set you up for success in the program. Now, with that being said, we're doing static stretching. So therefore, you're going to get into the ideal stretch, which is you're going to take the muscles to the point of first resistance. So it's going to be a little uncomfortable, but it shouldn't feel like you're stretching the muscle apart. And then you're going to hold that for 20 to 30 seconds. And then, the same type of thing with the autogenic inhibition, holding that. And then once, you can get greater range of motion, you can either go a little bit deeper and do it again, or you can switch and go on to a different muscle group. So it depends on how much time you have. It depends on how compliant your client is. But ideally, this is super important. And this is also, these two areas are the areas that your clients will say, oh, I don't have time for that. Let's just start the program. But it's important for us as trainers that we emphasize the importance of doing it either when they get there on their own and you see them do it, or you do it with them before you get started.
And do you mind if I ask you a follow-up question on that?
Sure.
So everybody who comes in to see you as an individual, and having said that, everyone's nervous system is on a different time frame. How do you know? How do you know when your client's ready for the next step of training? What are some things that those trainers listening now can look out? What can they look out for or understand to know that their client is ready to move on to activation?
Oh, well, basically, again, it is a continuum. So when you say move on to activation, you want to look at the muscles that are overactive that you've determined in the assessment, and then you're going to find out what's underactive, because once you get the muscle back to hopefully its ideal length, because again, you're not going to increase length of a muscle, you're getting it back to its ideal length of what you're hoping for. But in order to maintain that, you have to activate the opposing side, which I know is what we're going to kind of talk about in the future.
Yeah.
But if you do that, that's actually going to increase range of motion at the joint, and which is going to produce better movement patterns throughout the workout. So as soon as you get done with, again, 3 to 4 stretches, it may not be, you're not solving everything at once. And again, it is it's a continuum. It does take time. Again, it takes 4 to 6 weeks for our body to adapt to the new demands we're placing on it. And that includes stretching as well. So we can't just assume that after 1 or 2 sessions that muscle is going to go and be perfect. It does take time, and it does take a lot of work.
Okay, great, thank you. And I want to go back to you, Marty. But before I move on, I take exception to something that you said. I have not done anything stupid today. So
I didn't say today. I just said in general.
Yeah, in general. I'm on my clock resets every day. So right now, when we're working within the lengthening portion of the corrective exercise process, do we only perform static stretching, or can we use active and dynamic? And what are the cases for each?
The answer will be it depends. It depends on what phase of training I'm in. So
in general, we want everyone to go through the OPT model and improve their human movement as they go. Sometimes you will find that depending on, when you meet people, what their current training program is, what they're willing to change, you may not get everybody to start back at that's what we want. Of course, that's the best case scenario. So, if I have someone that's got, they move fairly well, but they still have some slight tightness in their hip flexor complex, I could do the foam rolling for whatever body parts I think is appropriate for what I'm going to put them through. I could statically stretch their hip flexors, but then I would go right into active, and I might stay there if I'm going to stay in the strength phase, or I may have to move to dynamic if I'm going to have them go do something more powerful, because you can improve a lot of human movement. But, somebody coming right out of, let's say a 45-minute commute or a 8-hour day at their desk, they might move well, but they still may look weak before you put them into, that higher level. So the way the model is written is in a perfect linear progression and really disseminating what the science is for each of those phases. But that doesn't mean that when Wendy or myself or you, Prentiss, we train somebody, we don't use the entire model to our advantage. But if I had to say anything more than, what's most important is don't move them too quickly, and don't think, oh, since I can do all three types of stretches, they're ready for dynamic and power right away. No, that's not what I'm saying. I'm saying that if there's a chance that somebody moves well enough to go through to a power workout, it's okay to do a static stretch in the beginning of the workout. Just remember, the model's stacked on top of each other for a reason. They still need to do their active stretching, and then they would need to do something dynamic. We're not going to do something statically, get everything to calm down, not fire up those other muscles and movement patterns to get them ready for the power. So again, the model's beautiful. That's why it answers every question. It's just having a full, deep understanding on how to use it case by case.
Okay. So do you mind if I give you a case? I want you
Absolutely.
to put your ATC hat back on for this. You're in the ballpark. You're in the ballpark or on the basketball court, and you're getting your athletes ready to play. How do you take them through the corrective exercise process to get them game ready?
Yeah, this is a great point, because last time I was in pro sports, I got hired right before the season really started. I didn't have the full off season to get everybody through what I would have wanted to in a perfect world. So they were coming into me, quote unquote, in shape, but they moved horrifically, right? So athletes are in great shape sometimes, but they're just tremendous compensators. Doesn't mean they move efficiently. I didn't have the choice of saying, hey guys, time out, I need 6 weeks. It was like, wait a minute, it's day one of spring training. So what we had to do was kind of merge the whole system together. So first we did everyone's assessments, and we highlighted people that truly needed a lot of attention from corrective exercise, maybe even manual therapy, etc. That we felt, okay, you're not injured, you're still going to go on the field, but you really need a very specialized program that you're not going to get in the team's generalized warm-up. Then when we did the team's warm-up, we started out with some static stretching. We didn't foam roll on the field, but we encouraged people to do it before they would walk out to the field. And then we would go through, basically, if you have to kind of, guess in a sense where people are going to be tight. Most people are going to be tight in their calf complex, hip flexor complex, adductor complex, lats, pec, and the neck. So we would put those in a progressive way. We would start out slow with the static, then we moved through active, and then we moved into dynamic. And then in between there, I put some core stabilization exercises in. They would do a plank. They might do a side plank. They might do a bird dog. They would do some glute bridges as I moved out of static into the other phases. So that way I'm getting these movement patterns fired up. I'm getting their central nervous system fired up. I'm starting to get them a little more ready from when we got them up and started doing some running programs. But again, even the running was progressive, right? 50% and a longer deceleration, 75%. Then I'd start to shorten the deceleration. So that way, everything had a very progressive manner. And then we really encouraged during the training that they'd go through all the phases of training. And then every time we tried to get them to do recovery work as best we could, because we need them to be ready for the next day's practice. So we would have everybody come in and do foam rolling, static stretching, or if they were kind of flagged, manual therapy, and then that additional process.
Okay. So if I can, so that if I can paraphrase you, You're using the process, you're calming down their nervous system to get that range of motion, and then you're firing that nervous system back up to the speed in which they need to perform.
Correct.
Okay.
And getting that fire back up with the proper movement patterns now, because we've been
Sure.
able to calm things down that maybe we're going to do too much work if we jumped right in and had them start moving.
Okay, and I'm going to ask you the same thing, Wendy, because I know that I also did this a while ago, where you would have a player who players are now using personal trainers in addition to their strength and conditioning staff with their teams. I've had the player come in like 5 weeks before the season or 5 weeks before a big fight and say, "Hey, coach, I need to get in shape. I need to get in shape for camp. Can you help me out?" So, Wendy, what kind of magic do you work in those 5 to 6 weeks before the player has to report?
Well, I mean, again, I've worked with all different sports, and I think it really depends on the sport itself. I mean, right now we've got mainly like PGA golfers and NBA people who I'm currently working with today. So taking that into consideration, you've got these golfers that are still going out. I'm going to use golf right now as an example, but you've got these golfers that are going out to play practice games. And, because obviously they're not playing anything major right now. However, they're coming in with 3 degrees of internal hip rotation, and they're still doing things and wanting to know why they can't increase their club head speed, or why they're, feeling things in their lower back, when, us now as professionals and kind of getting used to using this continuum and then trying to build off of it. You're going to look at the assessment. Again, you're going to find out what's overactive. So when a client comes in and we have a certain amount of time, we are going to try to inhibit those areas that are overactive. We're going to activate it. And so for us, like I'm trying, and it doesn't matter what athlete, but if I now bring in an NBA guy, the guys that we have come in, I'll do some manual therapy work. I'll do some PNF stretches with them. Then we immediately go into activation. And that's with everyone. So every one of my clients, no matter what phase they're in, I immediately have them do some sort of glute bridge and lateral tube walking. And for me, it's because a majority of those individuals, especially professional players and everyday people that sit down and have common compensations, their glutes are weak, their outer hips are weak, and they're causing a lot of movement imbalances that is going to affect their overall performance in their program. So I always choose 2 or 3 corrective exercises that we do, and then we begin their actual workout. So, if there's major compensations, we'll start them in phase 1. If we're limited on the amount of time we have, we may do, phase 1 for a week or 2. It depends on how often I get to see them. And then would go into a phase 2, and then we may have to jump straight into power. I mean, it depends on how long I truly have to get them ready to go. But, if it's a complete off season, then we actually go through the entire 5 or 6 phases, depending on how we're looking at it, or even 7, if we're doing CES all the way up to power or max power, and then we're undulating the periodization. So we're trying to maximize and make them as explosive as possible, but so making sure that every time they walk in, they're not broken down. And if so, we need to try to look at what are the major things we're seeing right then. Let's try to relax those muscles that are active, and then immediately activate those things, and then get them into their program. So doing the corrective exercise continuum on the front end of any workout, I think is very critical for what I do, and I've seen nothing besides success using it with anybody, whether they've ever worked out all the way up to the highest level.
Okay, thank you for that. And then Wendy, we want to stay with you. I want to ask you a couple more questions. So you're going to have to go back to or put your LMT hat on.
Okay.
Tell us, now we talk about the foam roller and we have various vibration and percussive techniques, but can you elaborate on some inhibition techniques that we can use for our muscles in the first part of the corrective exercise continuum?
Well, sure. I mean, as a licensed professional, you can use the manual therapy techniques like, massage or assisted soft tissue mobilization. However, if we're looking at the context of a personal trainer or exercise corrective specialist or fitness and strength and conditioning professionals, you can leverage tools like foam rollers, the roller balls, the handheld devices like a stick, a Theracane, anything like that to perform compression or compression with movement, techniques to target those specific soft tissues. You can also, use local vibration tools like the Hyperice, the Viper, the Hypersphere balls. And that's something that the clients can use themselves at home as well as when you're with them. You can also add the local vibration, because there's a ton of benefits with that. It's to be a little more effective at enhancing range of motion than just rolling alone. And it also increases the pressure pain tolerance, making it less painful for clients, which, a lot of times people don't like to foam roll because it hurts too much. And sometimes that vibration can calm that down as well. And then, of course, there's the handheld muscle percussion devices like the Hypervolt or the Theragun, those type of devices that offer a little more passive experience with your clients, and that have also shown to be also very, very effective.
Okay. Want to ask you, you brought up a really good point about vibration and tolerance. So when we're using those vibration or percussive devices, do we what setting do we want it on? Do we want it at the low setting, or do we turn it up to 11?
Always go high, start high. No, it really depends on the area that you're working on. I mean, to me personally, if I'm using, let's say, the Viper, which is the foam roller, and I have it on my back and I'm like doing, trying to get a little more thoracic extensibility and mobility in that portion because I'm at a computer all day. If I put it up really high, I feel like my rib cage and my heart are going to explode out of my body, and it's just not very comfortable. So for that area, I may choose a lighter setting. I mean, always start light and work your way up because, again, you don't want to go to the extremes. There's a lot of different research out there depending on the actual vibration hertz and stuff, and what kind of benefits you get in certain areas of your body. But in all reality, if your client's going to do it, then let them kind of play around with the settings and have them do it on one that they're comfortable with. And then as that gets easier, then, for instance, on the Viper, there's 3 levels. Start at 1, then go to 2, and then go to 3. And it can be over time, or it can even be in that same session. So if you're doing your calves, start at 1, then go to 2, and then go to 3.
All right. Thank you. And then going with that higher setting, there's no adverse effects, nothing that trainer should be worried about using those higher settings with their client. I
mean, obviously, we want to think about the contraindications anyway. So, if there's any contraindications to start and they shouldn't be using any type of implement, or they're not supposed to get deep tissue massages. I mean, we want to look at whether that person should be even doing, using that type of device before they even try this. So, I mean, if they've gotten cleared, the doctor's cleared them, they've never had any problems, and they want to use it, then I think it's fair game, and they're going to get a lot of benefit out of it.
Okay. All right. Awesome. And this question is for both of you. Since you were just talking, Wendy, I'm going to give you a break and get back to you. So we'll start with you, Marty. This question is coming in from Hannah. And Hannah wants to know if you can elaborate on the pin and stretch technique. She uses the specific examples of the calves or the quadriceps, hip flexors. What do you mean by saying move through the range of motion while rolling? I think you touched on that earlier. She says that she's CES certified, but with the old material and she doesn't understand what encompasses the pin and stretch technique.
Gotcha. So let's start if we were doing our calf complex. The way I like to do it is I'll go through the whole muscle belly and see if I find an area that's more sensitive than others. If you're in a shorter time period, you might just go to the first spot you feel. So again, you're going to find an area that is sensitive. Again, as long as it's appropriate, because the pin and stretch technique may make it feel a little bit more intense depending on the person. So we don't want it to be that 10 out of 10. So let's say I'm in mid calf and I feel a little tenderness. At that point, I'm going to take my foot and now actively bring the dorsiflexion, because as I'm coming into dorsiflexion, my calf complex has to lengthen. And now I've pinned that muscle belly down. So now I'm getting that added stretch from where the pin or where I put pressure into that calf complex, and I can really centralize that stretch. And now I'd also recommend moving in 3 planes of motion. So you can externally rotate your leg a little bit, internally rotate your leg. And sometimes as you go through that complex, and don't always just stick in that neutral position, as long as all your 5 kinetic chain checkpoints are in alignment, it's good to externally rotate and get into some of the perineals. It's good to rotate internally, get into some of that medial calf. And then I would just do the same thing. I would let my foot relax and go into a more plantar flexion, then slowly, it's not a fast motion, come into dorsiflexion. And when I feel increased pressure, I'll hold that position for a second or two and then try to work past that. In the quad, I'd be more like in my plank position, and then I would just bring my leg into, or my knee into flexion, like my heel towards my butt. And again, trying to increase that length in my rectus femoris quad as I'm finding that pressure point. And again, I'll also roll my leg back and forth, internal, external a little bit, to see, if I can really find that specific area as I go through that knee action to knee flexion.
Thank you for that, Marty. And I wanted to highlight something that both of you said earlier, and that's about that pain response. Now, your body tightens up because it, in some cases, it can be a protective mechanism. It's not sure what it's doing in space. It's not going to allow that joint to move. And what you're doing in that pin and stretch technique, Marty laid that out for us perfectly. But when you're moving that joint through its active range of motion, your body's going to give you a couple of signals, a couple of barriers that you don't want to cross, or it's going to start to have the opposite effect. So you want to move gradually increase that range of motion until your nervous system says, okay, I get it, you can move now. So, and that's something, as Wendy said, also, it's going to take time to practice, to learn how you move, learn how your clients move, so that you can use this technique effectively. And Wendy, did you have anything to add to that point?
Nope, I think you guys did a great job.
Okay, so this next question is for you, Marty. If you see a bunch of compensations on your assessment, how do you know which to inhibit and which to lengthen? Can you inhibit some and stretch others? And do they have to be the same? So let's give you a case of an asymmetrical weight shift. That's something that we may commonly see on an overhead squat assessment. And take us through that process, and I think that'll help answer the question.
Sure. So starting from the high, like the broadest answer, and then working our way down, is you can foam roll every muscle group. Because a muscle that's chronically shortened is going to have tension, and a muscle that's constantly lengthened and being pulled on, in a sense, is going to have tension. So the good news is you can foam roll everything as long as you're following the instructions in the book. You're not like foam rolling your sternocleidomastoid, or you're putting the big foam rollers in your lumbar spine or cervical spine. So if you follow those guidelines, you can foam roll any muscle. Now, in the book, we are identifying the overactive tissues because we're really trying to get to the point and change how people move. So we're foam rolling the overactive muscles that are causing bad motion or faulty movement. And then we're going to statically stretch those. Now, when you go into the static stretching, you only want to lengthen muscles that are chronically lengthened. There's no value in stretching every muscle. If it's already at its maximum length or past, you're not going to get any benefit. And kind of going back to what you said in the last second or two, is you can go in the opposite direction and get negative effects. So be very specific. So we have the solution table in there for you. So study that. Every time you assess somebody, you're going to look at exactly what muscles are listed, and that's the best way to learn. So I'm going to pause and say, don't go by how somebody feels necessarily, because a lengthened muscle can feel tight to somebody. That's why we assess. We've talked about the hamstring complex before. So now when we jump into the asymmetrical shift, now let's just talk about going through just foam rolling the muscles that are overactive and stretching the muscles that are overactive. Okay. So if we're having an asymmetrical shift to my right, so you got to look at the best way I remember when I was taught is think about the pelvis. Did the pelvis move toward one femur and away from the other? That's how you determine what's adducted and what's abducted, because that really confuses a lot of people. And I wish I had my dry eraser board. Wendy knows I like to draw. So if I shift to my right, my pelvis moved to my right, which now means my pelvis is closer to my right femur. So it's in a generally adducted position. Now, since my pelvis moved away from my left femur, that's in an abducted position. So those would be your overactive muscles right off the bat. So you would go through, and it's in the manual, it's in your textbooks on which ones you'd foam roll and which ones you would activate. So you're going to actually do the opposite on each side of your body. Because again, going back to stretching everything and strengthening everything, if you have an asymmetrical shift, how can you correct it if you don't do something different on one side of the body than the other? So that's where a lot of people get confused in the asymmetrical shift. So, we're not going to spend, towards the end of these, maybe Wendy will go over an asymmetrical shift as a case study. But generally speaking, clearly my right adductors would be overactive because they're pulling me, my femur, my pelvis together. And then my left abductors would be overactive. So I go through that process, and that's what I foam roll to inhibit. And then I stretch. And then we go to the opposite muscle groups to activate to try to bring everything back into its ideal posture.
Okay,
So
thanks for that.
Answered it for you.
Yeah, and I want to pick up one of the other points and kind of use our assessment flow chart as an example. You get a lot of compensations. We've all been sitting at home for 6 to 8 weeks. We have stuff going on. There are going to be a lot of muscles that show up tight on our transitional assessments. How do you know which ones to prioritize so that we're not doing this forever?
Yep. So I think we touched on this before, and the key thing is, and Wendy mentioned this in the very beginning: practice, practice, practice. The more you practice, the more you're going to see patterns. Right? You're going to see, hey, if I do this, I saw a lot of things clean up. And again, remember, there's more than one assessment, which will help you narrow in your focus. So if you do the modified assessment, you elevate the heels and you see everything clean up, hey, a lot of things improved when I focused and I took the foot and ankle out of it. So they must have a lot of issues there. And then you're also, as you study the solutions table, you're going to see that the hip flexors cause multiple movement compensations. That when the foot externally rotates, those muscles cause multiple movement compensations. So you'll start to learn how to prioritize. Also, if somebody has more than one compensation, which is very common, two things you're going to look at, which is the biggest compensation, and then also what body part am I training today? If I'm doing total body, then I may have to kind of look at everything. But if I'm only doing lower body, I may not worry about their arms falling forward as much as I would their low back arch or their feet turn out. So that's where you have to determine on, is it a half-hour program and I'm not doing total body, I'm only doing lower body today? Well, then I'm going to focus, of course, on their lower body. If today's more of an upper body day and they're doing some pressing patterns, then I may have to look at, okay, why are their arms falling forward? Why do they have the forward head posture? We want to clean it all up. And again, going back to what Wendy said, the better you get at programming, I can sprinkle in what I call a lot of accidental exercise, why I'm doing other things, keeping their chin in the right position, keeping their shoulders back. By keeping those 5 kinetic chain checkpoints in order at all times, you're strengthening those positions. You're getting them more used to those positions. Even if I didn't have the chance to foam roll and do all the stretching, I'd still rather teach them to always be in the right 5 kinetic chain checkpoints if I had to isolate their lower body. Still going to have some carryover. Not as good as if we had the time to do everything. But that's why, Wendy hammers those 5Ks all the time, she calls it. And that's why she's smiling in everything, because, again, it'll all add up over time and making somebody a more efficient mover.
Okay, thank you. Thank you, Marty. I want to go back to you. Wendy. And Marty brought this up a couple of times with the head. Now, we've all been working at home. And I, like everyone else, have a screaming case of laptop neck. And where my upper cervical spine is hyperextended, so I have that forward head carriage. Let's go back to inhibition techniques. And is there anything we can do that a trainer can do or someone can do to inhibit like that sub-occipital area? And that's something that definitely needs work because of the postures we adopt daily. Is there something that we can do for that?
Well, certainly. I mean, the thing is, we often see the big foam rollers, and obviously now the new hypervolts and stuff. I mean, obviously you're not going to take the volt to the occipitals. I mean, I guess you could, but it's probably not advised. But you can get tennis balls and put them in a sock and just place them kind of right in the base of that area, or something that is a little bit harder, or even your fingers, and just kind of hold those areas and relax it. Now, granted, if you don't have a license to do that with your client, you can really just get them more, instead of inhibiting with a foam roller, just get more of the stretches going on. So obviously we know if it's forward, the sternocleidomastoid is really, causing a lot of issues, and the muscles in the back are really weak. That's allowing that compensation to occur. So, by going through the 3 different neck stretches for the scalenes, the sterno and the levators, if they're, obviously elevated and in a rotated position, going through static stretches of those, and then going into just retraction of the chin. Or I'll tell a client, if they're actually driving, try to actually make double chins against the back of their headrest. Because when people drive now, you'll notice that a lot of the car seats even push their head in a forward position, versus keeping them in a back position. Or, if they're at home, just going through doing just chin tucks, for a slow, hold for 3 to 5 seconds and then relax. So there are different things that you can do without it having to be like this big, long, process. It's really just kind of looking at what are the muscles that are causing it, and then what can you do to fix it. So.
Yeah. Yeah, and I love my hypervolt as well. Just using it back in that area reminds me of a scene from No Country for Old Men.
Another movie.
Yeah.
Every week.
But you can take it nice and easy. It actually kind of feels good if you just take it and go there. Just don't actually hit the bones. It doesn't feel the greatest when you're actually in that area. Yeah.
Does not feel good.
Exactly.
And let's just stay with you on that train of thought, Wendy. What if you can't do? What if you have a client that has some challenges with mobility or their ability to get up and down and can't do inhibitory techniques? How do you work with them in this case?
Yeah, well, that's a great question, because it's going to, it commonly happens. And so it's very valid. But going back to our earlier question about, what are the different ways to inhibit a muscle for the clients who are less mobile, you can leverage some of the different tools that are available, like the handheld devices, such as the stick, the Theracane, the stuff that we've discussed. But, you can also modify the position of your client by doing things in a seated position, standing, things like that. Some of the more recent research shows that you don't need a ton of pressure to elicit positive effects. So with rolling and other myofascial techniques, like harder is not always better. So, to that point, another advantage with these tools that use vibration, is that you don't necessarily need a ton of pressure to still experience the benefits, especially if you are using something with a vibration stimuli, But, if worse comes to worse, you can take a client and put them up against a wall with a foam roller and just have them kind of lean into that. You can take a roller and put it underneath in their adductor magnus and have them sit into that. So you don't have to always put someone on the floor. You want to think if you can't get them in a comfortable position and they can't for some reason do any kind of rolling technique or any of these other, use any of the other devices, because maybe they do have a contraindication, then you would just take that out of the program because it's not beneficial for that client and it's deemed unsafe. So then you would just have them do static stretches, on the appropriate muscles that they need to stretch. But instead of maybe just doing 1 rep for, 20 to 30 seconds, you may have them do 2 or 3 different reps. And instead of doing 20 to 30 seconds, maybe you hold them a little bit longer. So again, everyone is individualized for a reason, and you just kind of have to think of what's going to benefit them the best to get, any kind of elongation of a muscle that has been shown to be short or overactive.
Okay, and I wanted to pick up on one more, or actually one of the points that you made about not needing super hard foam rollers. Now, both of you've worked with big athletes, and you may have seen in the popular fitness space a couple of years ago that you get some of these big guys, and they're the proponents of taking something just short of a steamroller and rolling over the muscle Even with someone that big, can you explain the density of the roller and kind of what they should be using to have beneficial effects? This is for both of you. Just jump right in there.
Well, so I'll go first. Sorry, Marty, but because I'm sure you can pinpoint something that obviously the softer the implement, the less pressure is going to be put on it. So again, the foam rollers that are white, they break down very easy, but they're also they have a little bit more give. So they're not as painful. It usually goes white and then, blue and then gray. And then, then you can get into some of the ones that have, the harder devices that don't break down over time. Obviously, you want to think about the density of the roller as well. The smaller the implement, the deeper it goes. So if I were to do manual therapy, my thumb is going to hurt a heck of a lot more than if I gave a client a foam roller, because my thumb is a lot smaller than a roller. So you want to think that if a client cannot relax and they're in so much pain, and you have them on a white foam roller and it's the easiest one that you can possibly give them, and they still can't relax on it, then they're really not going to get the benefits that we're talking about and the whole purpose of why we're having them rolled to begin with. So at that point, what you do is give them two rollers and put them side by side, because again, you got to think now, instead of it being more specific, you increase the roller is now over a wider base, so you're not putting as much pressure on those specific points. Oftentimes you see people on their TFL or, they're rolling their quads and they're so miserable and they can't relax, really getting the benefit. But if you put two rollers side by side, then they start to relax and then it gets easier. And as their body adapts to that, then you can take the other roller away. Then you can start to increase the stiffness of the roller or whatever implement you're using to get those benefits.
Okay. Marty, do you have anything to add to that?
No, I've covered everything, but the only thing I'd say too is what I've seen people do is they just think it's better, but it hurts so much that they don't spend any time on the roller, and then they go really fast, and it looks impressive that they were foam rolling on a piece of PVC, which I've seen. But I'm like, but you didn't spend any time on it because it hurt so bad, and let's assume even if their muscle was relaxed. So we're looking for desired outcome. It's not about, like you said, rolling on like pool balls and PVC. And if you can get to that point, if there's a reason, great. But also, at what point are we bruising the muscle anyways? And, if you need that much, maybe you're good and just do a maintenance with something that's not quite so aggressive.
Okay. All right. Perfect. Thank you for that. And for those of you who are listening, we have a couple more minutes with Wendy and Marty. Please ask any questions that you have. This is very important. And this kind of sets the table for what goes on, or like the effectiveness of your training session. So ask questions. And while we're waiting, let's start with you, Marty. What are your takeaways today, and how do people find after this?
Sure. The biggest thing with any of the corrective stuff, and I could even tie this into fitness, is it's consistency, right? Like you don't get in shape overnight, and you have to do things all the time to stay in shape. But corrective is so important because Wendy's heard me say this. I know Prentiss, you heard me say it. No one even sleeps in ideal posture. So even if I spend 10 minutes a day doing some light correctives, there's 23 hours and 50 minutes where I'm probably in some level of bad positionings and postures. And when I'm working out, I should be in ideal posture all the time. But, we're computers. I traveled a lot before all this. And, it's that cumulative stress that we have to take care of. So I try my absolute best to do correctives multiple times a day. In between calls and stuff, I'll go hit a foam roller or two. I've got them spread out throughout my house, so they're in every room, so I don't even have to go searching for them. I travel with one in my bag when I'm on the airplane, so I can, always be doing that. So the key thing is be consistent with it, and, you're going to find such huge benefits that you'll become more apt to want to give it to your clients, and then they're going to see the benefits of it. So that's my big takeaway, is consistency. And then to find me, my Instagram is miller.marty72. And then my NASM email is marty.miller@nasm.org.
All right. Thank you, Marty. Thanks for those thoughts. Thank you for your contribution today. And thanks for sharing sharing some of your afternoon with us.
Absolutely.
Before you, of course, and Wendy, before you give us your big takeaways, Libby has a question, and thank you for listening today, Libby, and I forgot to thank Hannah, so thank you, Hannah, if you're still with us. But Libby wants to know if you have any thoughts on voodoo floss bands. She found that they can eliminate pain immediately. She's never used them on her clients, but they enabled her to continue a workout. You have any thoughts on that?
You know what? I haven't ever used them. So okay. I'm probably not the right person to ask for that. Marty, I don't know if you ever have.
I haven't used them yet. I've been doing the research on it. And I think like some other advanced techniques, under the right application with the right person and with the right client, I think that it looks like there could be potential for it. I mean, I know we cover it in our, we add that into our new corrective. So I still think it's in its early stages from a research concept. So I think that we're really going to have to study the contraindications, most importantly, when you look at really restricting, that muscle's ability to move, where also we talked about, blood flow and other fluids you're also restricting that. So I need to get more comfortable with what if somebody had high blood pressure, has high blood pressure. Like, I'm just not there yet to where I'm comfortable giving it out. But it's on my to-do list to learn, because I've seen a lot of people say that they really enjoy it. I just don't do anything until I've mastered the technique on myself and know the research behind it. So it's on my bucket list of need to get better at.
Yeah. Sorry, Libby. I can't help you with that.
And, I'll chime in as a former manual therapy practitioner as well. Largely, it depends if it works. Everybody's going to have a different response to any intervention. And absolutely what Marty and Wendy have both said to some degree, you have to understand the mechanisms, honestly, and you have to understand the contraindications before you implement that on everyone. So in anyone. So while they may be good, we don't know. I don't know if it's good in every circumstance. It's just something that requires a little more testing. People are going to respond different to different interventions.
And I think, that goes along with everything, because everyone is going to respond different. Some people do excellent with cupping. Some people do excellent with dry needling. Some people do excellent with different types of treatments. And that would technically be another little tool and device that you would use on someone. So again, if Libby's comfortable with it, she knows how to apply it correctly, the client is getting results, then it's helpful to that client, then it would be helpful for her. And maybe that's an expertise that she puts along in her book of special things that she can do. So.
Yeah. So Libby, your answer is a typical trainer's answer. I get coaches with more than 15%, about 15 years of experience, and our answers most of the time, it depends. So yeah, it really does depend. But if you're getting some success with it, by all means, definitely continue using that. And as we finish up, Wendy, what are your takeaways for today?
I think the big thing is, again, start to make sure you feel really comfortable with the assessments, because the assessments are really going to dictate what muscles should be, especially when what we're talking about today, what muscles you should inhibit, what muscles you should lengthen. Because again, when we start moving on, and it is a continuum, having these two areas of really being able to identify what's overactive and short is important, because it's going to help you and the muscles that are going to be lengthened and underactive and that you want to focus on. I think that we need to really reinforce that corrective exercise can be for everyone. So it can be for the high-end athletes. It can be for someone that's never worked out before, and that it can be the beginning of a program, no matter what phase you're in, as long as it makes sense for the client. So, practice some of these different tools if you haven't used some of them before. If you've never used the vibration, maybe start adding some vibration tools into your toolbox and see if you enjoy it and get the benefits. And just, yeah, like Marty had said over and over, look at the solutions table, start to get accustomed to what's over and underactive, and then you'll hopefully get a lot out of this.
Yes, and again, how can people find you after this?
My Instagram is wendy.batts13. My Twitter is just wendybatts13, and wendy.batts@nasm.org is my email.
All right, thank you for that. And I just wanted to chime in really quickly about any of these solutions. What we've given you is we've given you a baseline. We understand from the evidence that that inhibition and lengthening work as part of this process. Now, there are several practices, several ways you can accomplish that. And not everything could be covered in our text. So, I urge you to go out and see what you can add to your toolbox. And I'm sure a lot of that fits within the corrective exercise continuum. So you can go ahead and challenge yourself and learn different interventions in your scope and apply it to the model and make it work for you. So that is all of the time we have for today. I want to thank Marty and Wendy again. Always enjoy learning, listening to you talk, getting some insight from you. Everybody out there listening was able to take away some nuggets to bring back to your training practice. Have a great afternoon. Be safe, and we'll see you next time.